Okay, so before I get started, I just want to say I think I might be missing some things in my skills kit because I only have one of the ostomies, so there isn't, I'm not able to put one on here and then have one to redo. So I'm just going to pretend that there is one on here. I'm still going to go through every step, but just speaking as if there is one on here. And I also don't have a barrier, I have a barrier. I don't have a skin prep. So I was just going to use an alcohol swab. I know that alcohol is not a skin prep, but I was going to use it as pretending to be the skin prep. Okay, so I'm going to knock and introduce myself. So hi, my name is Brittany. I'm going to be your nurse today. I'm going to perform hand hygiene. First, can you tell me your first name? Okay, and what is your date of birth? Perfect. I have verified that you are the correct patient, so I'm going to put on some gloves, and today I'm just going to be changing your ostomy. I'm going to remove the one that you have, empty it, and then I'm going to put on a new one. Does that sound okay? Okay. So I'm going to put on some gloves, and this is when I would gently pull the existing adhesive barrier, making sure the patient is okay the whole time. There's not too much pain. Okay, I'm going to pull it off, and I would be holding it. Then I would cover the stoma with a clean towel and explain to the patient that I'm going to go to the restroom to empty the contents out and measure it. So now I'm in the restroom. I'm going to open the bottom portion here, and I would open it and drain it in, then discard of this in the biohazard bin, and I would keep this to measure and document. Now I would go back, regain hygiene, put on new gloves. Now I'm going to remove the towel, and I'm going to clean with a water-based wipe and a mild soap. I'm going to just clean the skin around gently. Okay, so I'll clean it, and I'm going to assess the stoma. It looks healthy. There's no abnormalities. So now I'm just going to measure the stoma with the measuring device offered. Okay, the stoma is 2 inches, so I'm going to take this out, and I'm going to cut this back portion to 2 inches. Okay, so now that it's at 2 inches, I am going to dry the skin around the stoma with a clean cloth, and I would take some skin prep and put it around the stoma. Now I'm going to take off the backing and place this on the stoma. Okay. Over. Okay. And I would use the heat of my hand to mold this to the patient's skin. Everything is good. So now I'm going to attach the bag. Okay. I'm going to check and make sure there's no leaking area. Okay, now I'm going to close the bottom. Sure. Okay, it is closed well. Now I'm going to discard of any used materials. Okay. Now I'm going to remove my gloves, perform hand hygiene, and I will ensure the patient's comfort. So are you comfortable? Okay, here's your call light. I am going to go document.